of April, it is now 40 days since Rwanda went into lockdown. This was among the difficult decisions taken by the Rwandan government as to mitigate the spread of the virus. Since the start of the lockdown on the 21st of March this year, the period has been extended despite of the fact that there were hopes that this would only last for 15 days. After 10 days with the decision standing, those infected with the virus in the country had multiplied at least 5 times from 17 persons to 82. The cabinet meeting that sat on the 1st of April resolved that the lockdown should be extended, hence adding a period of 2 weeks till the 19th of April. On the other hand, on the 5th of this month is when Rwanda recorded its first COVID-19 recovered cases, and that day 4 persons made it back to their families, and among these included 3 Rwandans and 1 Burundian. On the 17th of April, infected cases of COVID-19 had reached 144 persons, with 75 under medical attention and 69 recoveries. On the second time of the cabinet sitting, they again resolved that the lockdown should be extended till today, the 30th of April. This day comes long awaited by many. Even though they decide to ease up the lockdown, leaving people to move as usual, it will remain my responsibility to protect myself and my family against the virus. It will be very appealing, but that shouldn't interfere with other measures like the face masks and washing hands, and we are committed to protecting ourselves against the virus. Experts in epidemic diseases expressed results after 10 days of different measures by those with authority regarding the lockdown. These are days characterized by an increase in the number of infected cases, having 71 of them in a period of 5 days only. The Ministry of Health in Rwanda explains that the rise of infected cases is due to the cross-border truck drivers and their stakeholders. Analysts weighing in on the matter say that this explains the virus status in some of the neighboring countries that haven't taken up strict measures to fight against the spread of the pandemic. Dr. Menelas Nyeshimana, an expert in epidemic diseases, finds this a very big obstacle to taking another step of returning to business as usual before the COVID-19 pandemic. If you are fighting a pandemic, there are 3 things to consider: controlling the source of cases, stopping transmission, and protecting those that are more vulnerable to the pandemic, like the elderly or those with illnesses, as we've seen with COVID-19. Therefore, those measures are not specifically meant for one country, but all implementing them at once. Tightening up measures solely as Rwanda will never solve the problem. On the other hand, in a virtual press conference with journalists, President Paul Kagame announced that there is a likelihood of reopening some businesses, but advised citizens to keep up with the prevention measures. The 21st of April, the lockdown was officially announced, sparing out only those providing essential services. With extensions of the lockdown up to today, the 30th of April 2020, that totals up to a month and 9 days of Rwanda into lockdown.